The origin of Sinus and Snoring Specialists really came out of 20 years of clinical experience here in Austin. I was really fortunate to be involved in the creation of the whole field of minimally invasive, office-based nasal procedures. I came up with the original prototype that we use for balloon sinuplasty. And as we began to do these procedures to correct the nasal airway for patients, being someone that was also boarded in sleep medicine, I saw that my patients with snoring and sleep apnea who were having the correction of their nasal airway were just having a dramatic improvement in those conditions as well. What I really wanted to do was have one location with everything in that location necessary to manage sinus issues and allergy issues, to be able to have a positive impact also upon their snoring and sleep apnea issues. I wanted to have a mini CT scan in the office so we can look at the detailed anatomy of the nasal and sinus and be able to describe and review that with the patient in detail. We actually invented our own high-definition video nasal endoscopic units so that we can record and replay the inside of the person's nasal airway and show it to them on the day of that visit. If the person has complaints of snoring or sleep apnea and we think a sleep study is necessary, that they could go home with a home sleep testing device to be able to conveniently and accurately diagnose that condition in their own bed. If allergy was a component to it, we can provide needle-free allergy skin testing in that same location and actually provide the immunotherapy ourselves with convenient allergy drop therapy. The team that's been put around me and the growth and learning we've had in being able to further improve our techniques as a continuous process of improvement. Nowadays we see it. We literally, I think, change people's lives. Very excited to be part of this practice and what we're providing. So I feel like hopefully over the next 10 years or so that I have in practice, we can continue to make a really significant positive impact for our community, and as we have in the past also in other communities, by allowing other ear, nose, and throat physicians to come and look at what we put together and try to duplicate that in their community.